So when we look at the training that Trac9 provides, of course we do extensive training with Springboard, but let me just pause and say, they are not an organization that necessarily needs the basic training, and that is rare. I was able to come up with them and start at the very advanced level training. So some of these trainings that we do rectify some of the missing pieces for clinicians in their educational institution. So part of it is therapists are not trained in how to utilize data or assessments throughout the course of therapy. 95% of therapists are trained in looking at an instrument that you collect one time. Do they most likely meet this diagnosis? But there's so much more to that. So just like physicians that are treating a disease, if you are treating cholesterol and you see the cholesterol levels are not coming down, you're going to adjust. You're going to increase the dose on your statin. It's the same concept. Now, usually I have to train therapists on this technique, not at Springboard. So at Springboard, we're getting more into advanced techniques. So I was able to start at sort of the PhD level and coming in with their therapists and teach them about different techniques to identify things like, we can identify if someone is suicidal without asking them a single word about suicide. We can identify if someone is bipolar or suffering from an access to personality disorder. All of these things are advanced level interpretation techniques, and it's what we're able to do with Springboard, something that would take several months, if not a year, to get to that point with the treatments that are. I'm Dr. Dempsey, founder of Trac9. As a clinical psychologist, based on the results and outcomes we're seeing, I would highly recommend if you or someone you love is suffering from addiction, check out Springboard.